This is tracheostomy care. So you would first go into the patient's chart and make sure you know what type of tracheostomy the patient has. Verify that you're going to the correct patient's room that has the tracheostomy. So you would enter the patient's room. Hello, Mr. Blank. My name is Tricia with Respiratory Care, and I'm here today to help you clean that area around your tracheostomy. We're going to go ahead and do those cares today for you. While you're here in the hospital, we just want to check that site, look for any redness or swelling. Are you having any irritation at all with that now? Okay, good. But we check that for any swelling or irritation, and then we do that twice a day while you're here. So you can expect someone, either myself with respiratory or one of the other girls, any of the nurses to come in and do that for you. So you have any questions before we get started? Okay, so I would wash my hands, make sure I have my kit handy. With my kit, I have my dressings, a new cannula. We would have our sterile water or distilled water plain, and then we would also have hydrogen peroxide or sterile distilled water mix to go ahead and clean that area. So washed my hands, I'm going to put my gloves on here. We would also have a suction setup available because we are going to suction that trachea prior to getting all of this done. So sterile gloves, and then what we're going to do is we're going to connect our suctioning to the wall. We go ahead and suction that out a little bit and then discard that. Okay, so then the next thing we're going to do is we are going to untie the ties here, and we're going to keep a hand on the stoma at all times, or the tracheostomy there. We want to keep that secure. We don't want that moving around too much. So I'm just holding this the whole time we're doing this, okay? If you have any difficulty or if you're having any pain, just shout out at me, Mr. Blank, okay? The other thing we're going to do is place our sterile drape across the chest. We could use a towel or something as well, but we want to place that so I don't get water splashed all over you. So, all right, so we're going to remove the old dressings. Go ahead and discard those, and then I'm going to take out the cannula. So if we have a disposable cannula, we would have a new one ready to go. We would dispose of the old one in the garbage. If we have one that's not disposable, we would have a newer one, the non-disposable ready, and then this one we would take out and we would cleanse that very good with the peroxide mix, cleaning in and around that cannula, and then follow with a rinse of the sterile water, normal saline distilled water. Put that somewhere to dry, and we would replace that cannula. Prior to doing all of this, we want to listen to lung sounds. Of course, you want to assess your patient before and after cares, but we would listen to those breath sounds. So we've cleaned the cannula, then we're going to clean around. We're going to hold that stoma, clean around the site, and you're going to use your Q-tip instead of your brush with that peroxide mix. You're going to go one on each side, replacing those Q-tips each time. You only want to use one Q-tip for each area. Try and keep this as clean as possible, cleaning all those areas, and then we're going to go just a little bit in and around that stoma there. Then we're going to allow that to air dry. So we've gotten that dry. Then we're going to place our dressing back on, and we want to use a pre-cut dressing. Sometimes if we just use regular piece of gauze, if we cut it so that it fits securely around, we could get little strings, and we don't want those strings to go into the airway. So we have replaced that securely around, and then what I'm going to do is I'm going to take these ties and discard or put those aside and put some new ties on. So then I'm going to put those ties on here, make sure that's secure. Mr. Blank, does this feel like it's tight enough? Not too loose, not too tight? Okay, any discomfort anywhere? Okay, good. All right, so you'll be expecting to see us or someone come in and help you with the cares twice a day while you're here. Do you have any questions for me? Okay, I'm going to listen to your lung sounds again, assess the patient again, and then document what we've done.